Now for the next drug of choice, we'll get to talk about the pharmacology of what? Cytarabine. So this cytarabine is mostly sold under the brand name Ara C. Okay, so this cytarabine, we'll get to see that it's actually what? A cancer drug. Okay, that's and this mode, this type of cancer drug is actually what? Is actually a chemotherapy. Okay, so we get to look at the mechanism of action, pharmacokinetics, clinical uses, and adverse effects when you are using this drug. Okay, so this cytarabine is also known as what? Cytosine arabinoside. That's why they call it what? Ara C. Okay, so it's a chemotherapy medication that is used primarily to treat what? Acute myeloid leukemia, lymphoblastic leukemia, non-Hodgkin's lymphoma. Okay, mechanism of action is actually a pyrimidine nucleoside analog that works by inhibiting DNA synthesis. So as the DNA is not synthesizing, it will basically will halt the growth of cancer cells. Cancer cells will not be able to replicate and make different copies of their self. Okay, so it actually incorporates into the DNA during the S phase of cell cycle, where it actually inhibits DNA polymerase. And this will lead to what? A decrease in the level or decrease in the speed of DNA synthesis and repair. So DNA will be getting damaged, it will not be getting repaired. Do you understand? So it will ultimately result in the death of the cancer cells. Okay. For absorption, this cytarabine is what? Not effective when administered orally. So it's usually given through what? Intravenous injection. It could be intrathecal. It could be subcutaneous injection. Okay. For distribution, is widely distributed in body tissues and it crosses the blood-brain barrier. Metabolism, this cytarabine is metabolized in the liver by what? Deoxycytidine kinase and other nucleotide kinases to its active form, that's Ara CTP. For excretion, the drug and its metabolites are excreted primarily in urine, about 80%. Okay, that's within 24 hours. For the half-life, the elimination half-life of cytarabine is biphasic, with an initial half-life of about 7 to 20 minutes and a terminal half-life of about 1 to 3 hours. Okay, so for indications now, cytarabine is used to treat all those cancers that were mentioned. Okay, mentioned them early. Administration is typically administered as an intravenous infusion or injection. Alright, for adverse effects, can actually lead to bone marrow suppression, which can lead to things like leukopenia, thrombocytopenia, anemia. Right. Other side effects include like nausea, vomiting, diarrhea, abdominal pain, oral ulceration, and hepatic dysfunction. All of these are common. Okay, so that's it for the pharmacology of what? Cytarabine. Okay.